All right, this is administering medication using an IV piggyback, where you'll be using the back flush method to prime the tubings. And so the first start of this is a medication, and so you will start by doing your 2 medication checks at the nurse's station, or if there's a rolling computer, using the rolling computer. And then when I come to the bedside, I'm going to come in the room, wash my hands, introduce myself, ask Jerry his name and date of birth, and I'm going to scan his armband. I'm going to scan the medication, and I'll do the final check of the medicine. This is cefazolin, 1,000 milligrams and 50 milliliters. It's due at this time, and I'm going to run it in over 30 minutes. All right, so for this method, we are not going to take out a brand new tubing. We are going to use the piggyback tubing that is already hanging here. So this patient received cefazolin. Here's the cefazolin piggyback 8 hours ago. And now it is time for the new bag. But your facility doesn't want you to use a new tubing like this every 8 hours because it's wasteful. They want you to use the same tubing. So in order to do that, first thing I'm going to do is put on gloves. And before I actually do anything with the IV over here, I always want to assess the IV site. And so before you would hang a bag or give a piggyback or add a medicine, you should always check your IV site. You should look at the site itself, and you should notice if there's any redness or inflammation. That would be a sign of phlebitis. Or you should see, is there any swelling, coolness? That would be a sign of infiltration, meaning the fluid is going into the tissues instead of the vein. And then you should look for any leaking. If there's leaking, the medication's not going into the patient, it's leaking all over the bed. So I check my IV site before I do anything. All right, now I am ready to hang my new piggyback. I've done all my med checks, I checked the IV, and I'm ready to go. So I start off like this. This clamp is open right here. There is a bunch of air in this tubing, so I can't just hang a new bag there. If I do, my alarms, my pump's going to just start alarming and say, hey, there's a gads of air in this tubing. That is no good. So in order to get that air out, what I do is I open this clamp and I put this bag down low until I see the IV fluid running into the old bag. Now I clamp it and I look at it. I have fluid here in the drip chamber, and I look at my tubing here. Do I see any air bubbles in my piggyback tubing? Which I do not. If I did still see air bubbles, I would unclamp it and lower this again. So now I am ready to put my new bag right here because I've got tubing that doesn't have any air in it. So I'm still clamped right here. I'm going to take my old bag off, and that gets discarded in the garbage can. And here's my new bag. Remember, I cannot touch that spike, it's sterile. I take my cap off, put my new bag in, push and turn, push and turn. I hang my new bag up higher than the primary, and now I can unclamp here, and I can set up my pump again. So we set up the pump in exactly the same way that we set up when we used brand new tubing. I start by selecting channel select. I go over here to secondary. I pick my medicine, cefazolin. I find the right dose. The dose is 1,000 milligrams and 50 milliliters. It's right here. Then this pump is asking me, is this right? Cefazolin 1,000 milligrams and 50 milliliters was selected. Is this correct? Yes, it is correct. And then it's just wanting me to verify. It says press next to confirm. We have the drug amount is 1,000 milligrams. The diluent volume, that means how much fluid is in this bag, 50 milliliters, that's right. The dose is 1,000 milligrams, that's exactly right. I hit next, and now on this I have to fill in the length of time I'm going to use to administer this. So duration is going to be 30 minutes. 30 minutes. It filled in for me that that's 100 milliliters per hour. Is that right? If you have 50 milliliters in your bag and you're running it over 30 minutes, yes, you're going to run it 100 milliliters per hour. And then look at here, verify the secondary clamp is open. Yes, it is open, and then press start. Alright, and it tells me right here that I'm running my piggyback at 100 milliliters per hour. What's running is cefazolin. It shows it's 1,000 milligrams. And it tells me that's my secondary. Once this piggyback has completely infused, the pump will automatically in 30 minutes go back to the whatever rate you had set for the primary IV. This one was set at 10 milliliters per hour. My final step is I look right here in this drip chamber. Do I see it dropping? Do I see the drips and that it is flowing before I leave the room? And now you're all set. Your piggyback is running. You should come back and check within a half hour or an hour. Make sure that it completely infused and that your patient did not have any reaction. Alright, so that is all for hanging the IV piggyback using the back flush method.